real quick, why do we do this? And Dan, I just, as we compile all this information, why do we do this webinar? Why do we do this work? Why are we here?
I'm hoping that there's a grander purpose to all of this. But the reason we're sharing today, the reason we're doing the State of Addiction marketing for the year, for all of your planning, is that we've had demand for this data. We've had a lot of requests. The Treatment Center Investment and Valuation Retreat in December. It's my effort every year to use our data to predict the future and tell everybody what's coming. But it actually resulted in a record number of downloads for our fourth quarter data benchmark report about pay-per-click, SEO, the numbers and benchmarks you should be experiencing. And the overall goal here is to just add transparency, right? The word transparency applies a lot to this industry. And we're just trying to share data that other groups might view as proprietary. What we have found is it results in more good questions than anything else. And if it helps you eliminate waste, it's going to help us all to better serve not only the companies we work for, but the patient population that continues to increase in demand.
Absolutely. And I'll just speak on a personal level as a person in long-term recovery myself. I was introduced to this world through a Google search. And I was not somebody that was living on an island somewhere. I was a person of means that had that should have had access. But the first place that I went was to Google, and I found that as we continue to do this work, that digital marketing really is the only true B2C channel in this space. And so I'm personally invested in this and glad that we could put this information out there in order to connect more people with the services that they so desperately need. So to move on, let's get into this. I do want to talk about the state of addiction treatment, and the state it's strong. If you guys were part of our benchmarks last year, you could see this throughout all of the events that we were at, that we hosted or held. You could see this trend, and we are doing very well in this deal. I mean, no other major healthcare provider in the space has had such explosive growth, and that's true. You can see it all over, right, Dan? We saw it everywhere last year.
Yeah, private equity is pouring into the space. Transaction volumes are high, valuations are high. It is the most sought after niche in healthcare, behavioral health across the board.
And I think that what's interesting in this, though, is that as we keep growing as an industry in this space, it's rather unfortunate because it's more needed than ever before, right? So as we see, the state of overdose deaths has also increased, and so they jump back again. And we talked about it last year. Whenever the stats came out, we were so shocked at the spike in the increase. And yet here we are again this year, continuing that trend. What have you seen, Dan?
Yeah, and I'll address some of the data on this later, but this is disturbing, right? I have a higher chance of dying from a fentanyl overdose today than anything else, just because I'm in my mid-30s. And that's insane when this has such a dramatic impact on society. And it's something that's trackable. We can see exactly where fentanyl is coming from. We can see exactly what populations it's hitting. But when it's now a leading cause of death, we need to change where the marketing messaging is going so that it's getting to that patient more directly and faster while there's still time.
Absolutely. I mean, the stakes have never been higher that a person, like, for their very first time using any illicit substance, has a greater chance of dying today than they ever had before. There is such that risk reward ratio is just so skewed today. And so it is so important that we continue to add services and continue to not only reach out to prospective patients, but also educate the public. And so with this problem and this concern, what we decided to do with our presentation today and going over is we started to do a real SWOT analysis. And I love these things. They're like actually putting together a real report that shows our strengths, our weaknesses, our opportunities, and our threats. And we're going to go through some of these in detail. We're going to talk about the strengths in market demand being as high as it has been. I mean, that is definitely a strength. More people are seeking help today. The stigma has been reduced more than it ever has before. So people are seeking help. That's definitely a strength. Some of our weaknesses, we're going to talk about clearly defining what we offer. We're going to talk about our targeting and alumni marketing channels. We're also going to talk about some of the opportunities that we have, some of the ways that we can deliver care that's differently today than it was before. And we're going to talk about some of the threats that are coming into this space, which is kind of interesting. The threats before were misinformation. Now I think there's many different ways to deliver care, and it's changed. All of this has changed, and that can be threatening. Now, I know that for those of y'all that are used to doing a traditional SWOT analysis, this will make sense, but we're going to throw a curveball in here. And instead of doing a line by line SWOT, we're going to do what I call a WHATSU. And,
God bless you.
and no, thank you, Dan, but I didn't sneeze there. All right, we're going to go in a little bit of order. We're going to go weaknesses, threats, strengths, and opportunities. So that's where that comes from. So we're going to start off kind of with the problem, and then we're going to roll into the solution. So with that, let's go ahead and let's get started, and we'll start talking about some of our weaknesses.
Tell us about your weaknesses, Glenn.
This is thank you, Dan. I will. This is something I'm extremely passionate about. And if you guys have run into me at any conferences or events leading up to this, or you will run into me, this is what we're going to talk about, is this first point, talking about what we sell in this space. I've worked in and out in all different aspects of this field when we start talking about behavioral health care, specifically substance use treatment. And we have a real issue in clearly defining what we sell. And even talking about selling something in this space sometimes has a negative connotation to it, and it's off-putting. But I think for us to really have a successful industry and help people, we do need to clearly define what we sell. We need to talk about the importance of creating a therapeutic alliance. I think that's a real weakness for us. I think that as an industry, we sell the results of our product instead of our product. I think that we sell to families and loved ones what is possibly going to happen and what they're going to experience later on in life down the road as a result of the services that we provide. We don't necessarily sell the services that we provide. And I think that's a real weakness of ours. And as we continue to unfold this idea throughout the next year and a half, I would really invite you to be a part of this conversation and help us to clearly define, what do we sell in behavioral health care?
I'm going to chime in here. I've heard Glenn give very robust talks about this, and the concept is a little simpler than that. Good luck billing or getting reimbursed for hope or another intangible. And on the marketing perspective here, what the industry has done an effective job in overcoming is stigma. The average American family does now know how addiction impacts them and can impact their entire social network and their whole world. So keep that in mind. You do sell a tangible medical service, not a feeling.
And I believe, thank you for bringing up stigma. I really believe that the stigma about addiction, around addiction being a disease, we've really moved the needle on that as a whole, as a community. I believe that the disease of addiction is more widely accepted today than it ever has been. I believe the stigma now shifts and the onus shifts to us on, does treatment work? And I believe there's a stigma out there that treatment doesn't work, not because we're offering subpar services, but because we're selling this idea to a family or to a prospective patient that we're not responsible for. And if we can clearly define what we sell, then we can help break the stigma around treatment not working. And that's what I hope to do over the next couple of years. And I invite you to join us in that aspect. The next weakness, I think, is managing the way we deal with the COVID situation still. We've been in this thing now for a year and a half, or almost 2 years now, and yeah, it has been, geez. And yet we're still learning how to adapt to COVID shutdowns all over. And so I think that's still a real weakness as we continue. Everybody's doing it different. Everybody's trying to adapt thing. We have grown in that. But we're seeing some interesting things as it relates to marketing. Specifically, I do see organizations scaling back during times of where there is a COVID outbreak, instead of leveraging those admissions into business development channels. And so there's definitely some growth that we can see in that, and I would love to see that across the board. Is that just because a facility experiences a COVID outbreak doesn't mean that people don't still need help. And it is our job to go out and reach out to those and still get them to appropriate levels of care, even if it's not in our facilities, if it's in our partner facilities or other relationships that we have, to where we still get those people help, the help that they need. And in turn, those tend to come back to us twofold later on down the road. We also need to talk about, speaking of stigma, we need to talk about the weakness of reaching the consumer, why 8 out of 10 journeys begin on Google. And I like to use this analogy a lot, that whenever I move to town and I move into a new place and I need to go to the dentist, I can go to my neighbor next door and I can have the conversation. Hey, where do you go to the dentist? I'd love to go check them out and see what they're about. No problems, no worries. But that conversation doesn't happen whenever it relates to a behavioral health care issue. I'm less likely to go to my neighbor and say, hey, you know what? My son's really been struggling with fentanyl usage this year. Where did you send your son to treatment? That conversation just doesn't happen. What happens instead is that the parent or the loved one goes online and goes to Google and starts asking questions. That's a real weakness, and it's something that we can address or should address. Another weakness is our competition, or knowing who our competition is. We really struggle in that. I work with a number of newer providers as they're coming into this market. And I ask them all, and so, who's your competition? And Dan, what do you hear whenever people ask you, like, or when you ask people, who's your competition? The one thing I hear more than anything else is like, we're different. Right?
Yeah, I hear the we're different, right? You just have to feel the warmth. And then I also hear a lot, oh, we're all in this together and I don't have competition. But then you zoom out on a Google Earth map and you see, 43 other treatment centers in the same county. So there is competition on a business level, on a mission and purpose level. Sure, we're all in this together, but there are only about 80 to 90,000 people a month seeking, with commercial insurance, seeking treatment. So you got to realize you are competing for a limited supply of people that are actually at that moment of seeking help.
Yes, and also, we give our prospective patients a lot of credit for knowing the difference between the therapeutic modalities we offer and the different ways that we establish a therapeutic alliance with the client. And the problem with that is that they're not as savvy as we think. They're all looking for a rehab program near me. And so that is our competition. If you're in a high, concentrated market of behavioral health care facilities, you are competing for the same individuals, regardless of the modalities that you offer, regardless of the ways that you create that therapeutic alliance. You are competing with those around you. And so that is a real weakness, I think, is that when people come in, they don't know who their competition is, and then not being aware of the budgets that are needed to compete in those markets. If you're in a highly, go ahead.
Do you see that this applies to large and small operators, or is this unique to one set or one type of treatment center?
This is all across the board. I had a conversation with a gentleman just a few weeks ago that was offering a very competitive price point and for his services, and was really invested in doing good work with his clients. And after we went over the marketing strategy that it was going to take to actually be visible digitally, his comment to me was that, well, that would mean I'd have to raise my prices. And that is what we're seeing. In order to really reach the consumer in this market, we all have to come together to have a real clear idea of what the budget is going to be to make that happen. It is so competitive. So knowing your competition is extremely important. And quite honestly, I think it's a weakness at this point. Oh yeah, one more thing on that. Underspending in this effort can be fatal. It really can. If you're it is just as dangerous as overspending. You can overspend, you can underspend, and both of them you're wasting thousands of dollars. And so, really knowing your competition and knowing your budget is extremely important. Another weakness that we have is internal alignment on website priorities. Dan, how many times do you hear this? Like, you talk in one meeting, you talk to the CEO and the leadership team, and they're very business driven. They're very much about conversions, the conversion rate. And then you talk to the clinical team and clinical director, and they are very much about helping people, modalities. You have so many stakeholders in this. You see that often, right?
Oh yeah, and just and totally disparate systems, different management approaches to clinical and operations. None of the numbers match. It can be a headache.
Absolutely. And then one of the ones that I think I see a lot is that when you're talking with owners that that are also really tied to personal recovery themselves, they're very mission orientated, and we love that. And it's very difficult to translate that to the business aspect of this. And so that is definitely a weakness and a challenge for us in this deal is aligning all three groups, both the ownership, the leadership team, and the clinical teams into a common message digitally. I think that's a weakness. And one of the last ones, connecting operational support systems. We talked to a number of facilities that will tell us that there's kind of a as they get the first click online, they can track them so far, and then the client enters this void where we don't know if they're a digital admission through this campaign, or if they're from an outreach, or if they're there, and they enter this big void. And so one of the weaknesses that we have is really connecting all of our systems to give real data that shows where are we best reaching our prospective clients. Does your do your digital marketing efforts connect through a call rail or call tracking metrics into a CRM, and is being tracked with your admissions team all the way through your clinical team and through alumni on the way out and then back? That's one of the areas of weakness that I see across the boards, that integration amongst all three of those. So those are some weaknesses, and let's get into the threats just a little bit. And Dan, I'm gonna let you speak to this one because you see this all over the place.
Yeah, this has been a really interesting environment for treatment centers to operate in over the last few years. And I think a lot of these new models were actually accelerated by COVID. So there's new opportunities, and what a lot of groups haven't seen in their marketing. And I'm talking about board meetings I've been in since January 1st, 2022, right? They don't see these indirect competitors as an issue to their marketing. And I'm saying it is both a threat and an opportunity. We'll address the opportunity side later, but indirect competitors, so new models like medication assisted treatment, right? You can open hundreds of outpatient MAT centers for the same price as one large residential treatment campus, right? And that volume of care could treat thousands and thousands of patients, right? And so they might keep working and prefer outpatient MAT even as a first attempt, instead of ever even engaging in deeper levels of care, residential levels of care, anything that takes them away from their income or workplace or family. So some of the future casting, and I want everyone to keep on their radar, and they're coming after the same advertising channels as you, right? There's the obvious ones like telehealth, okay, huge mental health, primary and SUD telehealth platforms with billions of dollars behind them, somewhere between 4 and 6 billion funding these projects. That's going to be a real issue, but it's going to be an indirect issue. So you might wonder, hey, why am I spending the same amount of dollars as I did last year, but getting 8% fewer phone calls? You've got indirect competitors taking some specialty inquiries from that volume, and you actually need to block that traffic. If you don't have telehealth, you need to proactively block it and have strong defense. These new models, right? New types of treatment, new requirements. In California, Medicaid is actually doing better reimbursements now if MAT is part of your prescribed treatment program, right? So that's government insurance level mandates, right? But what we are seeing is some of these models expanding for accessibility. My examples here on your screen are Mind 24/7. They're looking to deploy an urgent care model, right, on every corner for mental health primary. to be available in real time at the point of acute medical need, at the time of crisis. And we see a large shift into value-based care by the insurance payers. They don't want to pay for something where the outcome is very difficult to track, if it's trackable at all. And treatment centers have not deployed a consistent, same criteria-based outcomes reporting or advertising system. So the insurance carriers are pushing you that direction anyway. They're only going to pay for outcomes that they can verify. And there's risk in that, because a lot of that can be patient reported outcomes. And so you all on the clinical side can see the issues there. New threats and new budgets because of the current remote work environment and urgent care workers and hospital workers seeking other healthcare segments to work in. There is a threat there because a ton of money is being spent to target your staff, to recruit them and bring them into telehealth operations and remote work operations. And always seems like the grass is greener. So your marketing needs to, both defensively and possibly even for your own staffing purposes, target career level keywords, local job opportunity keywords, and you may need to build more content into your websites to compete with these other models. So you're going to see this continued shift in reimbursement. It doesn't mean, we get asked the question a lot, do I need to go in network to succeed this year? It doesn't mean that. It just means that change isn't on the horizon. It isn't coming. It's here. There are already thousands and thousands of MAT locations and thousands of psychiatric care providers working through telehealth apps. This is commonplace now. Over 98% of Americans will have had a telehealth appointment by the end of this year. So these are fully adopted technologies in play, and you can use them. If you're not using that for your alumni support, if you're not using that in your outreach for initial diagnoses, telehealth is an amazing technology, whether you're using it as a billable service or not. And then competition. As the private equity money continues to flow in, you have very well-funded programs, and a lot of them have very strong clinical. Some of these, David and Goliath scenarios, Goliath is providing plenty of good medicine with great people on their staff. So keep this in mind, that you need to, in your marketing plans this year, factor in indirect competition and all these new models, and make sure that you have services that are specialized enough and niche enough and targeted enough to still meet your patient demands and what they're typing into Google.
And I do want to add to that there is a precedent here where a substantial change in the behavioral healthcare landscape has really affected marketing efforts. And it wasn't that long ago that you look back and the majority of providers out there really provided a specific level of care. And the B2B marketing channel was extremely important in order to send a patient on a full continuum of care to get all their needs met. You had to have a number of partners, and so B2B was extremely important. And then the move, pretty recently, the move towards offering a full continuum of care. Nowadays, Dan, like we very rarely see providers out there that don't offer at least 2 levels of care, and most of them more than that, right?
Oh yeah, and that's expanding. We're seeing more models of full continuum, more models that are trying new telehealth technologies, or maybe have satellite locations for MAT or specific aftercare programs.
Yep, and what that's done over the years is it's actually driven more importance into digital marketing and in reaching the consumer directly, because there is less B2B. There's less of a B2B opportunity out there. So the precedent is there, and you can look back at trends to see that has been taking place really over the last 15 years. Wonderful. So let's move on. Let's dig into a couple of the strengths here. And Dan, you want to highlight some of these?
Sure. So good news. Bad news for mankind is good news for this industry's growth, unfortunately. So this pandemic has been very, very similar to the growth trends of the 2008-2009 financial crisis. And so the demand is high and is actually still increasing. So first-time primary mental health diagnoses are at an all-time high, and there has been a 27% increase in first-time primary alcohol SUD, since the start of 2021. So this year, I'm saying that will not only continue, it's actually going to increase. It is the socially isolated young adult archetype. That is the demographic you're targeting. It's no longer the somewhat textbook 18 to 24-year-old male opiate addict, okay? That was an easy default marketing label for your retail marketing efforts. It is now slightly older age ranges, age 30 to 45. It is first time, a lot of times self-medicating behavior, a trauma or social isolation for 2 years during COVID. And so thinking about this, the added stress of, just COVID itself, the added stress of highly polarized politics, that was a huge, you could literally see a spike in inbound phone calls to every single one of our clients right around election season. And guess what's coming again later this year? So you have an opportunity to expand your marketing during those periods of time, ramping up towards elections, and realize that consumer demand, there's always choice. This is a retail elective medical industry. Consumers can choose where to go, what type of healthcare to get. And a lot of them want to try the convenience of in-home care. It doesn't mean it works, doesn't mean it's clinically viable, but for a lot of people it is. And they can try it either local options first if travel was restricted for a while, or this new technology, this amazing telehealth technology that is on their phone waiting for them. So do realize that reimbursement trends are also positive. We're seeing groups like Anthem launch specialty behavioral healthcare products. That's first time in a long time. You are seeing parity laws being generally, obeyed and complied with. And so while reimbursements may not be increasing in dollar amount per se, there is positive reimbursement and demand dynamics, right? So this is still a growth segment. There is still a strong willingness to pay for mental health, co-occurring dual diagnosis and SUD primary, because it is all preventative healthcare, preventative medicine.
Right on. One of the things that I think is just definitely has been an advantage as we've moved through this is that with increased access to care, and that's what we're talking about here, all these different avenues are increasing access to care. So with these new vehicles and new channels, it's becoming more and more accepted to ask for help, to reach out for help. We're seeing that all across the board. And so that is definitely a strength. That is something that we as an industry are living in the middle of, and we're here to help others as they reach out for help. So that's definitely our strength here. And so with that, we have an increased access to care. We have much less stigma surrounding reaching out and asking for help. We have more of a, for lack of a better term, an increasing market that needs help. So I guess moving into our next section with opportunities, why are we seeing so many different responses where some companies are growing and taking advantage of this time in our market and others are not? And so Dan, let's go over some of these opportunities that every company has when it comes to marketing to make sure that they are growing with the needs of the time. And so let's start with this admissions first approach. Can you explain that a little bit?
Of course. And this is where we're going to start diving into the data now, right? So we wanted everyone to understand there is a retail marketplace here. That is what addiction treatment is. That's what behavioral healthcare is. It is a retail market. It is driven directly by business to consumer marketing. Okay. About 86% of your inquiries are going to come from Google. So you should be in a digital first marketing position, especially in the post-COVID environment. It will insulate you from future events like COVID as well. And you need to look at your timeline throughout the year, as we were discussing, for political benchmarks and certain marketing channels, pay-per-click versus organic, as it is impacted by your indirect competitors. So how do you do your marketing plan right now and start looking at the data? You take an admission first approach. And I don't mean to not be patient-centric. I'm not saying as opposed to a patient-first approach. What I'm saying is that in your marketing, a patient-first approach will give you amazing branding. You'll have very heartfelt messaging that highlights person first, individualized healthcare. And that's great. And that is how certain market segments work most effectively: cancer treatment, diabetes management, senior living. SUD is unique and behavioral health is unique because it is an acute need. By the time someone is reaching out, it is nearing or already at rock bottom. It is a very acute medical scenario. And so the strategy and role of digital marketing is immediate direct response, more like an infomercial. Okay, you want to say, call now, call now, call now. And a human being needs to pick up the phone in your admissions team, not a call queue, by the way. So I'm not saying admissions only. I'm saying admissions first. You need to have call to action everywhere. You need to be direct and invite the consumer into a dialogue, because one-way broadcast branding does not work in the current environment. Now, here's where it gets interesting, right? You're sending messaging directly to the patient or directly to a family member. 73% of the time, it's their mother. So you're talking to a female head of household most of the time, or directly to your patient. What would you say to them? You wouldn't say, you just have to experience the warmth. You would say, we can do everything we can to help you fight this disease and stay alive. Call now and we'll walk you through that process, help you begin that journey. But don't just say, begin your journey and leave it at that. You're not asking them to do anything or take any specific action. So walk before you run. Get your patient flow established, get your revenue solidified by targeting the right type of client for your treatment, for your level of care. Really refine that to minimize waste. Otherwise, you'll see huge percentages of your budget going to the wrong demographic. We just had a client, very, very well-known enterprise level client that was spending over 13% of their paid ad budget on age 65 plus, right? We know on Google Ads what household income looks like and age demographics and all of that, whether someone's employed or not employed. And they saw a 13% efficiency gain just from turning that audience off. Just by saying, you know what, we don't actually see many. Let's not be spending our money there. And realize that, there's a mindset to all of this. You have to be admission first, but get your messaging to the patient and deliver that call to action effectively and efficiently.
Right. We can't just stay there, right? We can't just stay in that admissions first approach always. There does have to be a more savvy campaign after the fact, but really this is the first step, is establishing this and then moving into the broader brand, correct?
Correct.
Wonderful.
So
Let's talk. You did mention a little bit about PPC or paid search. Can we talk about that just a little bit? Let's move into the next bit. Talk to me a little bit about paid search.
All right. So with paid search, and this can be a hit or miss solution to this industry. There's been a wild ride. I had an audience question about Legit Script I'll touch on in a moment here. But basically, there's a right way and wrong way to do it. We're a Google Premier partner. We're in the top 3% of agencies in the country by the amount we spend and the amount of certifications our staff has that manages that. I'm not saying that promotionally speaking. I'm saying that you can do it wrong. You can waste tremendous amounts of money if you don't have benchmark data. That's why we started publishing our benchmark report, right? If you're managing an in-house budget, for example, you don't know what everyone else's cost per call is, or what their cost per click, or what their conversion rate or click-through rate might be. And you can waste a tremendous amount of money just acquiring that data that you need to do your job. And your boss certainly isn't aware that you need that data to be effective in your job. They'll just blame you. So for those of you that are sitting in a marketing seat or an owner's seat, be sensitive to that the advantage agencies have and third-party media groups have is they've got everyone else's data. And so we're not guessing, we're going from a consistent dashboard about what converts the most. I'm not guessing that there's a 27% increase in first-time alcohol admissions this year. I know that as a matter of fact on thousands of admissions for residential care and detox, right? So what can be a hit or miss solution, if you fine tune it for household income, right? Are you getting a lot of Medicaid calls? Then eliminate your ad spend on the lower 50% of household income, right? Census Bureau database was just recently updated. Google is using that. It's not the bottom 10%. The bottom 10% of Americans are well below the poverty line. It's the bottom 30 to 50% of households, depending on blue collar employment with good insurance and blue collar employment without good insurance. It can be a game changer in your ad efficiency. The question I got from the audience, and I'll cover the other opportunities and weaknesses here, but basically with Legit Script, this is now a third-party background check provided just to have the privilege of running Google Ads, and it costs $3,000 a year. And Legit Script did succeed in its primary mission. There was such rampant patient brokering going on in the space for about 7 years. The FBI created a task force with over 40 people on it in South Florida, and they've been prosecuting like crazy under RICO statutes just to stop patient brokering. So Legit Script came in and said, hey, we can at least make it so that the Google Ads platform isn't the main source of abuse here. And they verify everyone's NPI numbers and medical licenses, and that their physical location is their actual psychiatric practice or treatment center. What we still see, though, is large admission call centers that are owned by treatment centers. To get Legit Script, they do need to be owned by an actual treatment center. They can still bid on your brand names. That is allowed. It's called conquesting. And in a retail marketplace, just like the grocery store, Google does allow Nike to bid on Adidas and Under Armour as keywords. It is simply another option, another good for consumers to evaluate. So you can spend defensively to protect your brand. You can be aggressive and click on anyone's ads over and over again that are bidding on your brand, and have your whole staff do that when they get home every day from different IP addresses. That's a good way to teach a lesson to those groups. But unfortunately, it's just a gray area, right? Treatment centers are allowed to bid on your name as a keyword. They are not allowed to use your trademark in their ad titles or the copy of the ads. That is something you report to Google and they will take action on. It can take a few weeks, but keep that in mind. Legit Script is helping in this regard. It has reduced the patient brokering volumes by insane amounts. You can no longer be a fake treatment center and run paid ads. And that was happening, just to put this in perspective, about $25 million a year of ad spend just that we were able to verify out of about 400 million of total ad spend. So 8% of Google ads were arguably being funded by patient brokers. And Google was having none of that. They literally turned this industry off for 14 months, just shut it off to $0 from 400 million a year. That's pretty responsible on their part, and Legit Script was a solution. What it did was hedge what I call Googleflation. There was a 5-year period where the cost per click of rehab keywords, which are the most expensive healthcare keywords, more expensive than mesothelioma litigation, right? It was a 12% annual inflation rate on those same clicks for the same keywords. And post Legit Script, it has only been about 2.3%. And that's in the highly saturated states, California, Florida. And we've given presentations with Legit Script. They really are focused on and trying to be the good guys. There is a cost to doing all background checks, just like employee background checks. So that's what you're paying for. But what it's doing is hedging your increased cost by a lot, by 10% a year, right? And keeping patient brokers at bay. That is the benefit. Otherwise, yes, it's an administrative frustration.
Yep, and we do hear that quite often from the audiences and the providers that we talk to. And Dan, for the sake of time, as we run through this,
Sure.
I just want to let everyone know, if they would like to have an in-depth conversation about paid search, we can definitely do that offline and reach out to any one of us to talk about this. I would like to talk just briefly about the device usage, and we all know that it's changed, and thank you to the pandemic, how we're all much more using our desktop devices much more than ever before. And our marketing channels need to take advantage of that in different places. Let's move in and let's talk a little bit about SEO just briefly and some of the changes there. And Dan, I want you to just kind of speak about this, and then we'll talk about Content Plus after this.
Sure. And as we're cruising through these slides, I hope everybody's paying attention to the text as well. But make sure you're adding negative keywords to your paid ad campaigns actively, weekly, frequently, so that you eliminate waste on your spend. and realize that people are on their desktop computer full screen devices more than they've been in half a decade, right? So display ads and other media channels, even streaming radio services and stuff, they're working again in limited volumes, but they're working again better than they have before, as is email. So make sure you have strong referral partner and alumni email campaigns in place. SEO. So Google did a big update last year, early in the year, right around April, called the Google Core Web Vitals update. And it has a whole bunch of variables. If your web guys have been bragging about how good they are at this, it was highly technical and it was difficult. Load speed, how quickly your website loads, especially on mobile, is a major ranking factor and became even more important with the Core Web Vitals update. Your backlinking profile, both quantity and quality, so that you don't have weird spammy backlinks. You may still need to manually disavow shady backlinks, even though you don't have to. We have seen that it does directly help your rankings. Digital press releases, so mentions, this concept of social media shares and mentions, and whether it's a backlink or not, does that count? Yes, it counts more than it used to. It counts a little bit. So your efforts on Facebook and Instagram and all that, they're not wasted. They won't directly drive inquiries same day, but it helps your overall website ranking and it's worth doing, particularly Google My Business. You need to actively manage that, be manually posting content to that, and use every single feature they provide to you. Use them all. So log into that Google My Business profile today and make sure it is robustly built out. And content, right? Content is what drives Google. All Google is software that reads text. And all YouTube is transcribing all of those videos to text and reading it. And that's why Google bought it. So publish a lot of content at a specific cadence. It's important that you frequently post that new content to your website to keep the Google gods happy. And you do need to be a net publisher of new information. Anything
right
to add
on.
to
So
that?
that brings us here. Yep. This is, talk to me a little bit about this. Plus, we mentioned a little bit about content, but what is content with interactive marketing?
Sure. So the goal is not just traffic. It hasn't been traffic for 15 years, right?
Right.
And the data I'm referencing in all of this is conversion data. What got about 150,000 people through our clients' websites into treatment? So actual converted admissions. There is a huge increase in a need for interactive content to the point where Google is actually creating their own. And this goes well beyond blogging and social media and some of its newer formats of media. We've all seen infographics and ebooks, but reaching and answering questions, reaching the patient and answering their questions in real time is tough to do because you have to predict what their question is. But you can qualify leads proactively. And so that would be self-assessment surveys. If someone is taking a quiz titled, "Am I an alcoholic?" we would all safely be able to wager that the answer is yes, right? If they're on a treatment center website taking that quiz. So you can provide advice and nurturing and engage in dialogue throughout that assessment. Google has seen this as such a common trend that they've actually created their own. On actual Google Health, you can actually take self-assessment surveys. That's very unique, very timely, and it's telling you what to do. So follow Google's lead. They're preferring this kind of content. Downloadable program content, right? If 73% of your phone calls are coming from a concerned mother, female head of household, is she going to bring her loved one, her child, her spouse back to the website? Or do you maybe have something she can download after providing contact information, and you are now a thought leader and you're building a relationship while she's shopping at 2 other treatment centers, right? The brochure she's holding is yours. So that conversion focus, right, being that piece of content that they download or print out or they have in their hand, gives you an advantage at converting at a higher percentage. And then building out niche programs. We've seen that specialty programs have been unimpacted on digital marketing. They have grown consistently throughout COVID in this new environment. First responders, trauma-informed care, women's specialty programs, you'd be amazed. They just consistently perform and have consistent demand. So consider breaking your overarching clinical program into some specialized treatment tracks, and you'll see higher conversion trends.
Right on. So moving into a little bit of talk about staffing and ROI.
Yeah, now this is interesting. We've both been talking a lot about this, Glenn. So we've got partners in the space that do a lot of staffing, and they're busier than they've ever been.
Yes.
I mean, how many calls a week do you get about this?
Like all the time. It's about half of the calls that I get are someone saying at the end of the call, by the way, we're looking for this type of person.
Yeah, and it's not a small shortage of labor. Millions of workers are the shortage in labor in this space. So the actual statistic is a shortage of up to 3.2 million healthcare workers. This isn't by the year 2050. This is by 2026, in 5 years. So right now there is already a shortage above a million, right, of healthcare workers, and it's not just ER workers burning out from COVID. It's not just vaccine-related employment changes. This is huge volumes of searches for private care, right? And for SUD, 80 to 100,000 a month. Digital marketing is going to make your phone ring, but you're competing with employers like CVS, okay? Their minute clinics are going to be doing psychiatric care. You're competing with billion-dollar funded organizations for telehealth. They want the exact same employees you want. And so this HR focused marketing, we've actually seen a huge return on investment from it for the groups that have already begun. Digital is a very cost efficient channel compared to many recruiting costs. And it's a lot of publicity. If you're hiring across the board, the perception is that you're growing across the board. And that is a positive perception of the brand, the organization. And it's going to get you better quality personnel, right? If you're ranking well for the job title someone searches, you'll get better candidates. So where we see the most focus and where you should focus any of your budgets is on admissions staff, tracking the efforts of your staff, right? If you can improve your conversion rate from a better admissions staff, you can spend less money on marketing, right? Best way to double the results from your marketing is to double your conversion rate on leads. And then utilizing the CRM properly. You might need some technical staff. Our clients that have added the most locations all have this trait in common. They have very robust and customized CRMs, and they're using them. So they're getting data and they know exactly how many people to staff per 100 phone calls and to hit their census growth goals.
And so we've got about four more of these opportunities that we need to hit here in the next 10 minutes or so. And so just to throw that out there, let's briefly touch on marketing before acquisition.
Sure.
A couple points on that, and then we'll move into alumni marketing.
Sure. So we want to see more groups connecting their systems, right? When your phone rings, does it automatically create a new lead in your CRM? Does it take you all the way through EMR? Does it take you through billing? And what we find is the better workflow you have, the cleaner data you have. And if we can say, hey, this exact keyword drove this exact phone call, which turned into a patient who completed your entire recommended course of care and paid you, right? You can use that data to go back and expand your marketing to target more of that exact type of patient engagement. So the operators that are connecting CRM, EMR, billing, and marketing are just crushing everyone else. I'm talking 8 to 10 times the conversion rate because they're using math to make their business decisions. Stronger security and HIPAA compliance actually gives you more consumer trust and a higher conversion rate. Implementing a 12-month digital ramp up before you go to sell has become a common trend. A lot of groups call us too little, too late. They say, hey, I want to sell my business in 60 days. I need you to do a whole bunch of SEO real fast, right? But if you make a plan, a strategic 6 to 12 month growth plan, you can ramp up a lot of value and maintain projections on that value for an acquisition. So marketing specifically to an acquisition, putting this technology and workflow in place, having a plan, that has been an increasing trend. The benefits are the buyer won't have to do as much investment to succeed after the fact, right? They'll have a nice sustainable census growth engine, and it'll match a private equity group's planning a little bit more cleanly. They expect these enterprise systems and strong data systems to be in place. And all of this just gives you a higher growth rate and increased ability to focus on emissions.
Yeah, we're definitely seeing an increased value of digital real estate, so to say, much more focused on that. All right, let's touch on alumni marketing. We know that it should be your lowest cost per acquisition. It's probably one of the biggest growth areas that we can see in any treatment center. What are you seeing, Dan?
So I'm seeing that and I'm going to pick your brain in this one a little bit as someone that's actually run alumni programs. We've seen groups with large volumes of alumni having as high as a 1-to-1 conversion rate. So referrals from those alumni, they have gone out and become evangelists and brand ambassadors simply because of wellness checks and keeping in touch during tough times like COVID. They've truly become friends of the treatment center and part of the community they're looking to build. The result is the same number of alumni they're keeping in touch with, a 1-to-1 ratio on new free admissions. So that is your best source of marketing. You could even generate, if you want to do the math this way, a new pay-per-click ad admission. If you know that later that's going to become a second admission because of your alumni marketing efforts, you can actually hedge the cost, right? Your true cost per admission is half as much if every new admission is going to yield an alumni referral later. And I'm not talking about just readmissions. I'm talking about total reach to their personal networks and who they're comfortable referring into your care. Doesn't have to be overcomplicated. The phone and text approach is wellness checks. How are you doing? Do you need anything? Do you need someone to review your resume? You want a good recipe for chili for the Super Bowl? That works very well. Email and text campaigns, just invite them to engage the community, right? Hey, we're doing some Zoom meetings, group meetings. Things have changed post-COVID. Do you need any help finding meetings? Looking for tools and resources. Social activities, right? Camping and canoeing can keep people out of a lot of trouble, can prevent relapse, connecting with the recovery community. And you'll be credited for that. You'll be credited for keeping them in touch with their peers in recovery long-term. And a dedicated website and resources. We've seen more and more groups asking for this. They already have strong websites. They're already doing pretty good at their digital marketing. They're looking to add specialty content to their alumni and promote, kind of pay it forward initiatives and lifestyle campaigns. So it's been great to see that. What do you see, Glenn, as someone that's actually run these efforts before?
All of the above. I really see the need for continued promotion of these groups out there. There have been so many situations where a program with a very active alumni was attractive to other alumni from even other facilities that said, I want to be a part of that. I want to be a part of the family or the team that you guys are putting together or put out there. And it takes such a small investment on the back end with supporting your alumni with some of these different communications tools and even just some of the events to continue to connect with. It really does make a difference on that end. I think that just every now and then having a nudge digitally through an email campaign or a check-in can make the difference with someone that's maybe on the edge of struggling or not quite sure what's going on with themselves. If they get an email that shows that you're just checking in on them, I think they're much more likely to reach out and maybe not hit that life-altering relapse. So definitely something that I would like to see more facilities and companies focus on. They also, your alumni is going to be your biggest advocates, right? And speaking of advocates, it kind of rolls into PR plus outreach. And so let's touch about a little bit on this. We'll talk about negative trends and we'll wrap up.
Yep. So this is a big thing that I find treatment centers to be lacking in, right? I ask, given the whole talks in this, what's the biggest brand? Who's the biggest brand in addiction treatment? Is it a treatment center? Is it Oprah? And I've made the argument that it is M&M, right? Still relevant, Super Bowl halftime show, one of the highest following influencers for recovery in the world. Here is where there is opportunity. I just hear on the news every night, COVID, politics, Canada, right? And what people need to realize is you can broadcast that this industry is relevant, that, overdose deaths are unacceptable, and you can have very strong advocacy messaging right now. And it is an opportunity to become the leading brand in the nation. There is not one right now. If you go back into the recesses of your mind to think who are the top 3 brands in behavioral health and SUD right now, it's going to be a challenge for you. So you can be, is my argument. Press releases work, earned media works, right? Getting interviews in the local news and local county radio and things like that. Here's why I think that. World War II, 1 million people died, 1 million Americans died. Iraq and Afghanistan, 59,000. And these are things that caused outcry and uproar, right? COVID-19, nearly 1 million deaths. I have not heard on the news. That's been on the news every single day for 2 years. I have not heard enough, anywhere near enough, about nearly 100,000 overdose deaths last year, right? And to go back for 10 years, we've got to be approaching 1 million on the record overdose deaths in the last 10 years. So we're all freaking out globally and shutting down society for COVID-19. And there's just not even a mention in the press of overdose. Very rarely fleeting messaging. So use this opportunity. It is a missed opportunity for tons of admissions and extremely strong advocacy press. They're not going to get a twisted story that gets polarized here. You're trying to save lives directly, and that is the message, and you can broadcast that loud and clear and proudly. Outreach representatives can be your best reps for this. It doesn't have to be a trained PR person. It has to be a passionate person who is either in recovery or cares an awful lot about recovery, speaking from the heart, just trying to reduce a leading cause of death for young adults, people that have long lives ahead of them. So another corporate way, business to business way to engage in this, instead of the press, you could send that same press release, that same effort and messaging to a human resources director and provide employee assistance and employee education about mental health and the current state of behavioral health and SUD and where they can pursue help. So moving on to our final few thoughts here. Negative trends, right? One that I'm going to weigh in on and then hand off to Glenn here. Patient call queues, and this has been great debate recently. Some groups have amazing admission centers and people, it immediately rings within less than one phone ring into their call queue. And you press 1 for admissions, press 2 to talk to a loved one, that sort of thing. But more and more lately, Americans are not willing to wait. They're not willing to let a phone ring 3 times,
Shocker,
then ring
right?
1 more time, right? And then still press 1. And you'll see a drop off. If this is happening to you in your call tracking software, you'll see a drop off between about 25 and 35 seconds, where you just get a lot of hangups and a lot of missed calls. And we've seen that happening more and more and more over the last year. So for 2022, have a human being pick up the phone 24 hours a day, every time it rings, and you will get the maximum yield from your marketing. And Glenn, if you want to walk us through some of these additional thoughts.
And I would like to say on that your tone and how you answer the phone is so important, that there has to be a blend of professionalism and empathy there as well. If someone's calling, even after hours, if they're calling an admissions line and you're answering the phone like, hello, like not like a business, you're not building trust with that client right off the bat. They want to know that they're going to be A, understood, but B, professionally taken care of. Like those are things that the client is looking for. And it really does matter. And if they're getting a press 2 to connect here, press 3 to connect here, and it takes them 5 minutes to get to a person, they're not only gone, they're not coming back, and they're going to have a negative user experience. When you think about this person that's calling your behavioral health entity, they're calling there in a state of fight or flight. Everything in them is trying to get them to leave this situation. And if your admission system is set up where it takes them a long time to speak to a real human being, they're gone. They're not going to be there. And like I said, it can create this negative user experience where it can negatively impact them and your company.
If you call 911, if you break your leg and call 911 and you get put into a call queue that takes 2 minutes to get through, you're already looking for an urgent care center instead. You're already looking elsewhere for help. So don't allow yourself to be subject to that negative experience, that negative brand perception, because there's tremendous opportunity in this. And even if you have a small staff or a small practice, just have someone on call each evening. Just, there aren't as many calls between midnight and 6 a.m. To really disrupt someone's life. So having someone on call, having admission staff for that, even if you don't have an enterprise call center, it's important. It's a big opportunity to connect, to drive revenue, drive admissions. So with that said, in 2022, focus on efficiency, focus on eliminating waste, expanding your alumni outreach for that 1-to-1 perfect ratio of referred admissions. On your pay-per-click, really, really hone it in on a specialty audience so that you're not subject to that indirect competition and that wasted spend in terms of, huge billion-dollar telehealth groups, going toe to toe with your budget. And with that, we'll be sharing a whole lot more thoughts, an updated first quarter benchmark report very soon in the next few weeks. We'll be releasing that for what you should be seeing in terms of cost per click and organic SEO performance, and a big map of the US and where we're seeing the most hospital admissions for SUD related disorders. And Glenn will be on tour. I'll be on tour a little bit, but where should we look for you?
Absolutely. I mean, we're coming up with, like it shows on the screen, will be a DFW Symposium, NACON, Autism Investor Summit, the RX Summit, BHB Value, NATAP, West Coast, East Coast. We'll be at Cape Cod, and we're real excited to see anyone. I will say this, that if we cross paths at any of these events, like come up and let's have a conversation about what we sell in this space. I'd be interested to hear your comments on what you sell. And let's see if we can't all maybe organize under kind of one initiative here to present a very solid industry for the consumer that's out there desperately looking for help. I would love to continue that conversation. Dan, when are we going to see you next? Where are you going to be out and about?
Let's see. I'm doing a whole lot of investor summits. I think got the Autism Investor Summit is up next for me, but I'll see you folks around at a whole lot of industry events all year.
Wonderful. If you didn't get a chance for us to answer your question or to get involved in the discussion, please feel free to reach out to us, set up a meeting, let's chat. We would love to go over anything as it relates from the nuts and bolts of SEO and PPC all the way up to kind of broader scope in the field of behavioral healthcare. We would love to help you tell your story and also help further this industry along so we can reach all of the people that really do need help out there. So with that, Dan, thank you so much for being here today and putting this thing together. And we will see you guys at our next event. Thank you very much.
Thank you, everyone.